In this longer video, I'll revisit the major parts of the lumbar spine, and I'll also overlay this on an oblique L-spine x-ray. First, here's the body again. That's the body of the lumbar spine. This bit of bone that juts off to the side, that's a transverse process. And the bit of bone that connects the body with the transverse process, that's the pedicle right here. And then in the back we have the spinous process, and the bit of bone that connects the transverse process with the spinous process, that's the lamina right here on both sides. And a part of the lamina, the piece of bone that connects the superior articular process seen here facing inward with the inferior articular process seen underneath facing outward, that bit of bone is called the pars interarticularis. Now that's a Latin term that just means part between articulation. So this is the pars interarticularis. If you ever want to figure out if you're looking at a superior view or an inferior view, just know that the superior view, you will see the superior articular process, and that is facing inward, and it's the opposite for the inferior view. When you're doing an oblique lumbar spine, you can see the so-called Scotty dog. Now the posterior oblique would demonstrate the right Z joint. So the right transverse process, the right superior articular process, those will be the area of interest, right? So in the oblique position, the transverse process on the right side, that's right posterior oblique, would be the nose, the pedicle would be the eye, the superior articular process would be the ears, the pars interarticularis would be the neck, the lamina would be the body, the right inferior articular process would be the front foot, and the left inferior articular process would be the back foot. Another way you can easily tell which side is the area of interest, the body will move towards the side of interest, right? So whether it's posterior oblique or anterior oblique, the body will move to the side of interest. So this will be then a left anterior oblique. So it's a side that's away from the IR. So the body has moved to the right side. We are demonstrating the right Z joints. Right anterior oblique, notice the body is now moved to the left. So we are demonstrating the left side. So it doesn't matter. So now we're doing a left posterior oblique. Notice that the body has moved to the patient's left. We are demonstrating the left side. So if you're ever unsure which side is being demonstrated, if you can see the Scotty dog, the body of the vertebra will have moved to the side that's the area of interest.